Hello, hi, good evening. How are you? Welcome. The time is 4:06 p.m. here in Nigeria, and I promised that I was going to be live today. So, I'm here this evening. Hope you're good. I noticed that a lot of people have been trying to ask me questions, and I decided that okay, let's come. How is the sound? And I decided that okay, let's come online and let's interact briefly today. So, in case you have any questions for me, you can drop your questions in the comment section, and I will try to respond to you. And I promised that I was gonna be live today, so I'm here this evening. Yeah, I like the sound. I'm coming. Give me a few minutes. Let's see. How's the sound? I decided that okay, let's come online and let's interact briefly. Okay, yes. The sound is cool. The sound is cool. So how are you? Good evening. If you can hear me and you can see me, let me know. I'm live on Facebook, I'm live on YouTube, and I'm also live on TikTok. This live session would run for maybe 1 hour or 1 hour 30 minutes. Now, if you're watching this live session and we have ended, I'm sorry, I might not be able to respond to you because I noticed that whenever I come online and I have this live session, some people always watch the live session, the replay version of it, and they drop questions. And when I don't respond, it looks as if this boy does not want to respond to me. So if you are watching this replay and we have ended the live session, I'm sorry, I might not be able to respond to you. Is that okay? Hmm? Good. Now let me see if I have my people. For those watching me on TikTok, you can join me on YouTube. Yes. Yeah, go ahead, no problem. Close it. Oh normal. Close it. Don't worry. Let's see. Continue. Close it. Close it, man. I want to check something. Close it. It's okay. Okay. Oh normal, how are you? Good afternoon. Yes. So let's gist. I dropped a video on hepatitis. That video is about 13 minutes long. I dropped the video yesterday. It's almost about an 24 hours I dropped the video. Let me see. I'm coming. Let me check something. I dropped the video. Okay, it's 24 hours a day ago I dropped the video. And the video has had about 183,000 views. Hmm. Mary, Mary Umoru. Mary, how are you? How you there? So if you have watched the video I dropped on hepatitis, let me know. Yeah, good evening, Bukola. I see you. Good evening, my doctor, my lecturer. How now? Adeola, I greet you specially. So let's gist, let's talk. Like, let's talk. If you have anything, any gist, any question, anything you want to tell me, I'm ready. Whether it's medical or non-medical. Hmm? Let's interact. I'm ready today. See, anyone, I'm ready. Ask me anything. I will try my best to see if I can respond to you. Let's see, who is this? Chacha. Chacha, where are you from? This your name. You get as it be. Where are you from, Chacha? Tell me, I beg. TikTok people, how far now? How far? How far? Uh-huh. Okay. Oh yeah, let's go. The video I made about hepatitis. If you have any question concerning that hepatitis, ask me now. Somebody was saying, I won't ask you. Can I ask you something private? I'm sorry, I don't do private chats on social media. I don't do private chat with anybody on social media. Who is this? Peace on TikTok. Peace, how are you? Rosemary, Rosemary on Facebook. How far now? Okay. Mr. Frank, Mr. Frank, how far? Okay, so everybody tell me, where are you watching me from? Abigail on TikTok. Abigail, I see you. Tess, soft Tess, I greet you specially. Oh yeah, let's go. From Enugu State. Okay, okay. Iyabo. Iyabo, how far now? Tell me, Iyabo, where are you watching me from? And let's do something. Tell me where you're watching me from and tell me how long have you been following me? Blessing Samuel, good evening. From Spain. Oshe, Oshe, Oshe. Yeah, Blessing is watching me on YouTube. If you are watching me on YouTube, in order for this live session to do well, I need you to like. Like and drop a comment. Wahid Afiz, if you're watching me on Facebook, like and share. That is how you support. Nnabuike Praise from Lagos. You've been following me since last year. So Praise has been following me since last year. Cynthia Nnamani. Cynthia, how far now? Good evening. Oh yeah, tell me. Idris Yakubu. Come, una plenty. Oh. What's this? The virtuous Lovette. Lovette, how far now? Love. Alexander from Taraba State. People plenty here today. Oh. Okay, let's do this. Adeyemi Jane, watching from Benin City. How far? Miss Iyanu, Bawoni, Nabi Williams. See. The people watching me here are so much. I think mine was last year too. Okay. Oga Dog, how far? I just scrolled down the message yesterday. I haven't really gone through it. Chatting you from Owerri. Okay, no problem, no problem. So if you haven't watched the video I made on hepatitis, watch it. And then if you have watched it, and you have any question, ask me. I follow you because you are a good doctor. Really? Am I good? Watching live inside Tamale, Ghana. I'm supposed to go to Ghana. I'm supposed to travel to Ghana one day. Oh. Maybe when I blow, when I become big by the grace of God, and I have money and I have fans, hopefully I'll be able to travel to Ghana, travel to South Africa, travel to Rwanda, travel to where again? Cameroon, travel, yes. When I blow. Isaac Silvanus. Isaac, how far? Okay, so Mr. John. Oh yeah, everybody share this live. Before you start asking me your questions, share the live. Today is ask me anything. Ask me any what, anything. That is today's live session. Ask me anything. Q and A. Just ask me anything and I'll answer you. So before I start, before I start taking your questions, I need you to share this live session so that I know we are together. Are we together? Okay, good. Oh yeah, share. I'm gonna respond to you. Doctor, so you know go answer my question. Guy, who be this? Kingsley, come to TikTok, come to YouTube or Facebook. Nna Best, medical Zaria, Kaduna. I love your teaching. Thank you, Nna Best. Come to YouTube. I don't ask you since my guy. I am not seeing your questions on TikTok. Come to YouTube, or YouTube is best. Come to my YouTube. I will respond to you, man. See, I can't see your question. So let's take this question now. Can a hepatitis B positive mother give birth to a child who is negative? Yes, the answer is yes, Mr. John. Yes. Faith, I see you. Faith from Bayelsa. How is Bayelsa? Good evening. How are you doing? Please, the vaccine we took years back. Can it prevent us from hepatitis, having hepatitis? I'm watching from Lagos, Nigeria. So your name is Mr. Kimley Sampson. No, I don't see. If you are above, if you are above 30, I think you should just go and get yourself tested first. Huh? Go and get yourself tested first. I doubt you have taken it. I'm honestly. But currently, if you are a man, a father or a mother, intending father, intending mother, and you give birth, the moment you give birth to your child, they will definitely give your child the vaccine in the hospital. Can you explain the difference between coffee and caffeine? Come to YouTube. I will answer you. See, don't worry. Do me a favor. Anybody watching me on TikTok, come to YouTube. I'll respond to you. Though I have a lot of questions. Come to YouTube. From Cross River, Mr. Frank is watching me from Cross River. Are you from Cross River? Unoma is watching me from Ogun State. See comment. Oh, praise from Anambra. Mr. Eze, praise. How are you? Audu Rose from Abuja. Hello, ma. You look fresh. Hi, Mr. Amos. Doctor, you are doing well. Oh, watching from Abuja. Thank you. Now, I hear this comment a lot. You are doing well. You are doing well. God bless you. I appreciate. But the best way to support me, I appreciate you, is just share. Share the live session. Share the videos. That is the best way. And I'm very grateful. I have been having constant headache and hardly sleep. Okay, we have over how many questions? Over 50 comments here. You have been having headache and you can't sleep. So I'm going to advise you, Mr. What's your name? Adeola. I'm not treating you here. Please, I beg you. I'm not treating you so that you don't substitute this conversation for a consultation. If you are having headache and you hardly sleep, your headache might just be due to you not sleeping. It might just be due to you not sleeping, because when you don't sleep, you give your brain little time to rest. So if you are not resting, or we should all go to YouTube. Yes, please, everybody go to YouTube. Thank you. If you're watching me on TikTok, come to YouTube. See, I'm going to spend 1 hour, if I can, maybe 2 hours on the live session. But I need you to share and support me. I will try my best to respond to you today. Yes. Okay. So if you are not sleeping, it might just be the cause of your headache. So why are you not sleeping? How long have you been having this problem? What is the nature of your job? What is your lifestyle? Have you been taking medications? What is going on? So, if you're going to ask me a question this evening, if you're going to ask me a question, make sure you give me enough information. Doctor, I have not been sleeping for 5 years. I have been taking this medication by myself because I find it difficult to sleep. Now I can't even sleep at all. What do I do? You understand? Don't just tell me my blockos is paining me. Abba now. Help me to advise you. Yes. Yes. Okay. Yeah, everybody go to YouTube. I'm watching from Port Harcourt. Okay. I'm watching from Abia State. My husband has Parkinson's disease. Please, any advice for me on his situation in regards to his food from Washington, D.C.? What's your name? Madam Gloria. Madam Gloria, you're watching from Washington. So sorry your husband is having Parkinson's. But with regards to Parkinson, food would rarely do anything. I don't know why you are asking about food. The most important thing with Parkinson, it's the brain. Parkinson disease is a disease of the brain. I hope you know, you have read about it. And the medications that will be given to your husband are medications that would help ensure that the brain eh, has a balance of certain neurotransmitters, neurohormones, or whatever chemicals in the brain. Food. Is there any relationship between food and Parkinson's? I doubt. I don't have that information right now. But food would rarely do anything. Would rarely. Huh? Yes, would rarely do anything. If you're watching this live session, you are welcome. Good evening. Good evening, Ada. Watching from Abuja. I see you. People watching me from Abuja. You guys are so many today. Oh. Michael Melody. Michael Melody is a lady. Hello, Melody. How you doing? Um, hello, Fredo. Hi. Watching from South Africa, does lack of sleep cause or pose any serious danger on us? The answer is yes. Capital yes. Now, if you are listening to me, first of all, your body needs about 6 to 8 hours of sleep. About 6 to 8 hours. For some people, six. For some, seven. For some, eight. But we notice that it's quite difficult to even achieve the barest minimum 6 hours because a lot of us we are hustling, we are working, we want to make money. When you sleep, you give your brain the ability to rest. You give your brain the ability to repair itself. You understand? So if you are not giving your body, you're not giving your body enough sleep. What you're actually doing, number one, is that you are affecting your brain. So all the benefits of sleep that has to do with the brain, you are missing out on them. Number one is cognitive function. The ability for you to think and to remember is affected. Lack of sleep can affect your hormones, can affect your insulin. Lack of sleep can affect your body weight, can affect your immune system. It's quite very big. What I'm going to do, I will try to see if I can make a video on the benefits of sleep and the dangers of not sleeping. With regards to this question you asked me, let me just give you a few tips to help you sleep. Number one, I'm not here. See, for those that know me, I'm not here to pretend to anybody. I'm going to be very real. I have a problem with my sleep. I have a very big problem with my sleep. And this is self induced. I do a lot of things. I read personally for my own development. I read because I want to make contents. I research. I record videos. I edit videos at nights. And what do I do again? I also respond to comments at nights. I listen to other people who are ahead of me at nights. Now, this stuff has affected my sleep. I know, but it has affected me. Listen, let's be real here. Let's nobody come here and pretend to anybody. Huh? In addition to that, something else again has affected my sleep. So what I try to do is whenever I can, I deny myself of some other things and shut down at times. It's not easy though. It's not easy. But what can you do? Number one is try as much as possible to reduce the engagements of the things you get yourself involved in. I'm giving you advice. This I'm also talking to myself. I know this one. I know myself. I know my problem. What I have never done is take any substance to help me sleep. I did that in 2019. I did that in 2019 and I stopped. So I was taking some things to help me sleep and I know the consequence. So I stopped it and God has helped me. So I will never advise you to take any substance to help you sleep. If for any reason you're finding it difficult to sleep, speak with your doctor. Number two, try to exercise in the evenings. Try to exercise. Huh? It will help you. Number three, ensure that your environment where you sleep is cool, is calm, and not noisy. These are the few tips I can give to you online. Huh? Yes. If you are not sharing this video, I have been following you since 3 years now. Really, Blessing has been following me since 3 years. Bleh bleh, bleh bleh. Thank you. I have over 100 people watching, but they are not sharing my live session. Can I send you a DM? Can I send you a DM? So I don't do private chats on social media. Hmm? I don't do for so many reasons. So if you are watching me, you are listening to me for the very first time, you're welcome. But there are so many things I don't do online. Number one is I don't private chat with people on social media. I stopped 5 years ago for so many reasons. So if you are sending me private message, I'm sorry, I won't respond. I have my very, very personal and professional reasons. If you want to speak with me privately, you would have to book for a consultation. Hmm? You will need to book for consultation. and you will need to pay for the consultation. Other than that, you can ask me your questions here and I will do well to respond to you. But private chats, I'm sorry, no vex. I know they do them again. Watching you from Owerri. Okay. Precious, how are you? Cynthia Nnamani from Lagos, how are you? Yes, so you are a good doctor. I beg you. Mommy Monisade, how you day? Are you? How are you? Listen, there are so many good doctors that are not online. And I don't think I am among them. There are so many good doctors. Trust me. Um, okay. Can you tell me the test to go for when someone did her menstruation twice in a month? It was 2 weeks. So there's a see, I beg. I don't want to speak pidgin English, but sometimes I just want to mix it up and with pidgin English. Listen carefully to me. Listen carefully. There is a very bad habit that some of you are doing, and you will get in trouble. You will suffer. You will waste your money. Don't come on social media and ask for tests. Madam, I don't know you. I don't know anything about you. I don't know your age. I don't know how old you are. I don't know if indeed you have a problem. So why should I tell you to go and do a test when I don't know a lot about you? Anybody who just come on the internet and says, go and do this test, go and do this test, there's a problem somewhere. So, Bukola, first of all, I don't think you need to do any tests. I'm going to advise you now, listen carefully. If this is the first time this has happened to you in your life, if this is the first time, relax. Don't go for any test. Watch it. Your body can do what? Can regulate itself. Maybe you were stressed or something happened to you. But if you notice that your period has always been once in a month, you see your period once in a month all your life, and then suddenly you are now seeing your period twice in a month with very short interval, see your doctor. Very important. So that you don't mismanage yourself, you don't cause problems, you don't waste money. Huh? So I've given you advice. So, and the funny thing about my people is that they like free advice like this. They want somebody to lie to them. I know that I'm not here for that. Should we type the question not related to hepatitis? Go ahead, ask me anything. Ask me anything. Huh? Ask me anything. Anything, whether it is health or non-medical. Ask me. Huh? I'm watching you from Ibadan. I have been a fan for almost 2 years now. Thank you so much, Mr. Wahid. Does H. pylori causes fit? What is H. pylori causes fit? Who be this? You know they won't follow me. You are welcome. I will be there to receive you, no problem. Which state are you currently in Nigeria? Why? Why is that important? I'm fine, oh. Yeah, evening, doctor. Watching from Abuja. How is Abuja? I'm watching from Benue. Thank you for being a good educator. Madam Grace, how is Benue? Where are you located? Why? I'm located in Nigeria, though. Hello, watching you from Ireland. How is Ireland? I don't share. Oh. Yeah, thank you for sharing. Uzo Dimma, I greet you. Joy from Taraba. How is Taraba? Please, what can make a woman to see her period 5 days? 5 days after. How? So you finish seeing your period today. 5 days after, you are seeing your period again. Are you sure it is period? What can make a woman see that stuff? There are so many reasons, so many stuffs, so many stuffs, so many stuffs. It might just be that it might just be so many things, so many things. What can cause it? Oh, I'm careful mentioning any diagnosis here, but it's not common. It's not common. You might have issues with hormone. You might have issues with uterus. You might be on medication. So many things, you understand. But it's not common and it's not normal for you to see your period, and after 5 days you see your period again. It is very, very abnormal. So how are you sure it is period? It might also be something that is happening around that area. Okay. Um, or maybe you are pregnant, but it's not pregnancy because you just finished your period. Don't ask me for treatment, my guy. Go to the hospital. Don't ask me for treatment. Listen, listen, listen carefully. I want to respond. I want to spend some time on the live session with you today, but don't ask me for treatment on the live session. Hmm? Go to the hospital. I beg you. I'm not here to promote myself. I'm not here to look for patients. I'm not here for all those. I'm not here for that at all. I'm just here to advise you, respond, have fun, and disappear. You understand? I'm not here for that. Please go to the hospital and let them treat you. Please, I beg, my guy. If someone is SS, what medicine can that person take? SS, they have their normal medications they take. Most times your supplements. But if somebody is SS, you are a sickle cell warrior. Number one, you should be you should join a foundation, a group, a community. In that community, everything you need to know would also be communicated to you. Number one. Number two, um, you need to take care of yourself. You need to avoid anything that will trigger crisis, stress, cold, extreme of weather, uh, dehydration, and so many other stuff. And then your normal medications that help you with your blood. So if you are a sickle cell warrior and you are listening to me, I think if you are a parent or you are the warrior, you should belong to a community, and that community would guide you. You should also have your doctor. I have over 100 comments right now, and I hope I'll be able to respond to this. Good evening. I'm watching you from Lagos. I have been following you since last year. I enjoy your life in fullest. I love your teaching. Thank you, Chinedu Alpha. Good job. How you doing? Please, doctor, pray for me as I prepare for surgery. Ruth Ademola, your surgery will be safe. I don't know the surgery you are going in for, but you will go in and come out in one piece. Everything will be done by the grace of God, will be done in the right way. God will take charge of your surgery, your doctors, God will take charge, and everything will work in your favor. I'm saying this because I'm an African and we pray. You understand? So any negative connection whatsoever, it will never come to pass over your life. In Jesus' name, Amen. Ah, okay, let's see. Watching from Malawi. After cesarean session, if you are not following me, follow me. I don't. Please, watching from Malawi. How long can hepatitis B vaccine give protection? Some people say for 20 years, some say for life. So if you take your complete dose, you should be protected for life. If you have had cesarean section, you should at least try to get pregnant after 2 years, 24 months. Oh yeah, share. Watching you from New York, discovered you a month ago, and I love your teachings. Bobby, how far now? How is New York? One day, when I blow, when I get money, I will travel. I will travel around the world. Promise from Abuja. Promise, how far? Good life na sense. So, yes, Ecom local government. Watching from Edo State. Okay. Happy weekend to you, Dr. Freddy. You don't see when somebody call me Dr. Freddy. Freddy. Now babes, they call me Freddy. Now babes, they call me Freddy. But my guys, they call me Fredo. Emmanuel Iyoha. Emmanuel from Canada. I greet you specially. How are you doing? Okay, now I'm gonna do something. I'm gonna end the TikTok live. So if you're on TikTok, join me on YouTube. If you're on TikTok, join me on YouTube right now. Go to YouTube and search for Doctor Fredostar. Spell the doctor in full, and you will see me live. Click on the subscribe icon and then wait for 5 minutes before you can drop a comment. Yeah. So find me on YouTube, subscribe, and then what again? I'll be waiting to respond to you. Yeah. Okay. Good evening, Doc. Watching you from Ilorin. Uh-uh. How is Ilorin? Good evening, sir. What is the meaning of Alpha? Alpha now, Baba. How you doing? This guy, are you okay? I'm live. I'm live on Facebook and YouTube. I didn't say you didn't even watch me, sir. Okay, no problem. I will check. I will respond. Yeah, yeah. Oh, yeah, now. Yeah, well done. Okay, so TikTok. I have to go now. Join me on YouTube. Yeah, let's end TikTok live. Okay. What is the meaning of CT scan of the brain? CT scan of the brain is a high level of investigation that is being carried out to find out what is going on inside the brain. It's it's a test when your doctors are suspecting that maybe you have a problem with your brain around your head. Let's just say your head region, and they want to know what is going on inside. It tells us all the details going on inside your brain. They request for a CT scan. So it's not as if you are. I don't know why they requested CT scan for you, but whenever they do that, it means that they want to get more information about what is happening to you. And I also believe that you have read about it. Good evening, good evening, good evening. Watching from Malawi. Yeah, I see you. Okay, I'm here now. So please, my question: what is the difference between coffee and caffeine? Easy. Okay, I hope you are here. Caffeine is found in coffee. Mm, I haven't taken out time to really. I don't know how I'm going to explain what coffee is to you. Coffee is like a beverage. Inside your beverage, there is caffeine in it. So people take coffee, and one of the constituents of coffee is caffeine. So whenever you take coffee, you are also taking caffeine. Is that okay? Now, caffeine can also be found in other products that are not just um, coffee related. You can find caffeine in some energy drinks. Huh? Yes, you can find caffeine in some medications as well. Hmm? Yeah, but caffeine can be found in coffee in its natural form. Hmm? Good evening, Doctor. I'm watching from United Kingdom. So everybody watching me right now, share this live session, share, and send stars, send super chats, super stickers. You can send chats, super stickers, and support the live session. You can send stars, you can send super chats on YouTube as well as on Facebook. I'm watching from Cross River. My God. Good afternoon. Okay, from Nigeria. Good evening, doctor. Watching from Cameroon. Please, I have two questions though. If one has taken the hepatitis B vaccine and has not completed the dose, that is one and two, but okay, has not completed the dosage. You've taken the first and second one, but has not taken the third dose, can he or she be infected? Secondly, what is the food that one can avoid after he has had a surgery on gastric ulcer? Thank you. So for the first one, if you have not taken the dose, the third dose, I think you might just need a booster dose. Yes, the first and second can protect you to an extent. You might need to go for a booster dose. For surgery on gastric ulcer, if you had a surgery, I can bet with you that your doctors advised you on what to eat and what not to eat. So what you should do is avoid things like fries, avoid things like spicy food, avoid alcohol, avoid beverages. What again? Avoid smoking. What again can trigger your avoid any food. Avoid which food again now? I'm just trying to be careful because it's not generalized, it's specific for each patient. So if you know that whenever you eat beans, you take fruits like oranges, like watermelon, you develop heartburn, avoid them. Yes. And then every other advice given to you by your doctor, please stick with the advice. Yes. And it's so funny that people are not sharing the live session, but they are asking me questions. Princess, how are you? Wow. Let me see if I can look for the names of the people that have shared. Juliet, Pinky. Juliet, how are you? Um, I'm watching from Benue State. My wife used to have miscarriage anytime she take in. What will be the solution? Your name is who, Mr. Desmond? I will advise you, Mr. Desmond, go to the teaching hospital. If you have a teaching hospital or you have a general hospital in Benue State, go there and see a gynecologist. You and your wife should see a gynecologist quickly because if your wife is having miscarriages, there's a very high chance this miscarriage will continue. Hmm? There's a very high chance that your wife will keep having the miscarriage. So, what you should do is to go to the hospital. Your gynae would check your wife, and then if there is a need, they would carry out some tests. They will find out when does this miscarriage occur. Is it immediately she conceives? Is it immediately she gets pregnant, or later on? Hmm? Is it that she's having a problem with uterus? She's having a problem with her cervix? She's having a problem with her hormones? Or so many other stuff. Good evening. Watching you from Ghana. How is Ghana now? Victoria from Sierra Leone. How are you? Good afternoon. I'm watching from Sierra Leone. Sierra Leoneans are so many here. You're my doctor. Hey, voila. I have pain at the left side of my stomach for about 2 days now. I couldn't pinpoint the cause. Any help? Watching from Ado Ekitis. And pain at the left side. Miss Madam Esther. So when a woman says she's having pain at her left side, if this pain has not happened to you before, okay, 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 take an analgesic. It will disappear, hopefully. But if this pain has been happening to you, it comes and goes, it comes and goes, and you are a woman, left-sided, you will do some tests. Listen, you will do some tests. But before you carry out those tests, we would need to examine you. We would need to examine your abdomen, find out a lot of things about you because recurrent abdominal pain in women is not something we joke with. Left-sided, whether it's left-sided, is right-sided, or bilateral, whatever the case may be. First of all, we will examine you and then recommend some tests for you. So if this thing has been happening to you recurrently, you have to see a doctor. But if it has not happened to you before, it's just the first time, you can take a pain reliever and watch it. You might just be lucky to disappear. Ella. Okay, Ella said yes. Uh, Mrs. Tina. My husband has been having this pain on his right leg for about 3 years. Sometimes It's swollen. That was swollen, right? And it goes down later. We got medications from the pharmacy, yet no way. It goes and comes back. Any advice? The advice is your husband needs to be at the hospital now. Your husband would need some investigations to be done. Recurrent leg swelling for about 3 years that comes and goes need some tests. Need tests. Listen. When I say test, it's to help us know what the problem is. And if I tell you to go and do, let's say, electrolyte, urea, and creatinine, if you do that test, eh, Cassidy, if you do that test and they give you the results, there is nothing you can do with your result because you'll be confused. Because you don't know how to interpret your results. So that is why whenever I tell you to go to the hospital, it's so that we can interpret your results for you. Because if I tell you to go and do maybe a urinalysis right now and you carry out that investigation and they give you a result, you can't do anything with it. Hmm? You'll be as confused as you were before going for the test. So recurrent leg swelling for 3 years, I beg you in the name of God, please go to a general hospital right away so that we find out what is happening to your husband immediately. Um, Dr. Fred, I want to know. See, the questions are so many. Oh God, will I be able to answer these questions? I want to know if a hepatitis B positive husband can infect his wife who is hepatitis B negative. Confirm mentor. Did you watch my video? Confirm mentor. Answer me. I'm waiting for your response right away. Confirm mentor. Did you watch my video on hepatitis B? Did you watch my video on hepatitis B? Now, for those people watching me, please, I don't private chat people. I don't give my number. I I don't private chat people. I don't give my number. If you want to speak with me privately, you would have to book for consultation. You will book for a session and pay for consultation. I don't have the time to be speaking with people randomly. Call me. Somebody says, do you have a longer version of your videos on YouTube? I'm asking because those on TikTok are very short. Yes, all the longer versions of my video are on YouTube and Facebook. TikTok is just for the short form. Yes. Please, I beg. I know they talk to people. Just take my number and call me. I don't have time for that. I beg, no vex. I don't have time for that. People go just they call me. I want to ask. I know fit. I beg, no vex, please. So, Mr. Mentor, if you are hepatitis B negative, take vaccine. If your partner is positive, as long as you have taken your vaccine, the complete dose, and your partner is also going for his or her checkup, you are fine. You are safe. Hmm? You are safe. Good evening, sir. Thank you for doing this great job. Okay, hey, God will bless you. I'm open listening to your teaching and watching your videos. I've learned a lot from it. Keep up the good work. May God continue to guide you. Amen. My wife just called me yesterday, complaining about the change of her period date. She normally sees her period on the 30th of every month. But unfortunately, she saw her period yesterday. I don't know what could be the problem. Yesterday, your wife is fine. What's her name? Mr. Thomas Roy. Your wife is very fine. Listen carefully, Mr. Thomas, and every other woman listening to me. Because you see your period on the 1st or on the 10th or on the 30th doesn't mean that your period will always come on that particular date. That does not mean you have a problem. Yeah, period does not work like that. Your body changes. It can come 1 or 2 days earlier, or 1 or 2 days later, or even 3 days. It's still normal. Is that okay? I want to be very fast because of time, and you people are not sharing. You people are not sharing at all. You people are not even liking. And I'm just surprised that. Let's see. Good day, please. What makes you feel as if something dangling in your head only when sleeping, and sometimes make you awake? immediately awake, it stops. I can't really say. I think it's your mind. It might be your mind. Yeah? I think it's your mind. What if you are a night worker? If you're a night worker, you might have a problem with your sleep. Yes. Koroma. Yes. What about banana? What happened to banana? What happened to banana? Banana does not trigger heartburn in people who have ulcer. If that's what you were asking, I remember. I don't think so. You can eat banana. It doesn't trigger heartburn. Doesn't trigger heartburn. Uh, what is the full meaning of CT scan? For God's sake, you can find this on Google now. Abba. Ah. What should be done to a pregnant woman with hepatitis B infection to prevent mother to baby transmission of hepatitis B? I'm watching you from New York and I discovered you a month ago. What's your name? Mr. Robert. A woman who is hepatitis B positive and who is pregnant should be given normal medications to also help her. And immediately she puts to bed, the baby will be placed on some medications as well. Hmm? Yeah. Omo, this is so bad. I wish I have data to watch, as this is the opportunity I've been waiting for. As Doctor No Gree private chat. I've done series of tests. I've spent a lot, but I'm not getting the result I want. I'm terrified every day for the worst not to happen. I pray I have data next time you're live again. What's your name? Hope. Hope. I don't know if you are here, but why are you scared? What are you testing for? Who is sending you for tests? I'm sorry. I know the private chat. No vex, I beg. Yeah, no vex. Doctor, if you sleep 3 hours during the day and later 5 hours in the night, can it be considered that you don't have enough sleep? 3 hours during the day, 5 hours at night. It depends on your body system, really, because sometimes the 3 hours during the day can help you, can make up for that 5 hours. Hmm? Yeah, it depends. Yeah. Doc, I was expecting, but tomorrow, not today. No problem. You're still fine. Huh? You're still fine. Yes. Can I go back to my former diet, having control high? I don't. Fatima, I don't understand your question. Thank you. Watching you from Jos. Thank you. I'm watching you from Sierra Leone, Bo City. How far now? Sheriff Amado. John, good evening from Ethiopia. Wow, Malawi, Sierra Leone, Ethiopia. I mean, 5 days after the day it's supposed to come, it's still normal, Cynthia. Cynthia, calm down, don't panic. As long as it is still within the normal range, relax, 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 relax. Sometimes it might just be stress. It might just be that there were some things you did that month that delayed your period. What causes skip of period for 3 months? I have a video on this. Please watch my video, I beg. Yeah. There are many reasons why your period can skip for 3 months. You might be pregnant, might be your age, you might be taking medication, you might have attained menopause, you might have hormonal issues. What again? You might have ovarian issues, many stuff. Yeah. Um, I'm watching from Italy. I've been having dizziness over a year, done a lot of tests, but the problem remains the same. So, Evans, Osas, Osas, how far? So, when you say you have done a lot of tests in Italy, what did they find? Hmm? What did they find? Sometimes dizziness can just be idiopathic, meaning that you cannot pinpoint the cause, especially if you are in a developed society where they have all the necessary resources for investigation. Hmm? Yeah. So it might just be. So I don't know. What did they tell you? What did they advise you to do? Huh? I believe they might have told you what to do. Now, dizziness can be caused by a lot of things. A lot. Sleep, ear problem, blood disorders, blood pressure. So many things. So many things. Is there a permanent solution to arthritis without taking diclofenac every time? Madam Folakemi Taiwo. Okay, so I made a video on arthritis. I know you have not watched it. A lot of people don't watch my videos. I don't know why. Eh? I want you to watch it. But the truth is that there is no cure for arthritis. Diclofenac does not cure arthritis. Diclofenac only helps you with the pain. There is no cure for arthritis, especially um, osteoarthritis. There is no cure. Please watch the video. So what you can just do is you can try to do little physiotherapy massage. Take some supplements to also support your joints and occasionally an analgesic, but there is no permanent cure. Watching you from Imo States. Hey, my guy, Williams. Are you still there? Williams, Williams, how far now? Williams, are you still watching? Williams, Alpha. The comments are so many. I'm just seeing your comments. And tell me, oh yeah, oh, Williams, Alpha, are you there? Let me see. If you are here. Hey, Williams, no day. This one said there's a cure for arthritis. If I was you, and so now go they deceive people. Which cure for arthritis? Joint joint replacements. And so now go they deceive people. We just carry mouth come online. There's a cure. If you ask am now, go they bend mouth. Williams, how far now? Let's see. Let's see. Ah, I'm waiting for you. Let me see if you are still here. Wait. I want to know that is there. Ah, Williams, no day again. Which advice would you give to an asthmatic person? Avoid anything that can trigger your asthma. Avoid anything that will trigger your asthma, and ensure that you have your inhaler with you. Avoid your triggers, basically. Hmm? Oh my god. 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 Oh, Williams is no more here. Oh Jesus. A thunderous amen. My question on hepatitis. You said the victim can eat anything food. Did you watch the video? Eat our normal food and eat healthy. Full stop. I did not say eat anything. No, avoid anything that will cause you fatty liver. Avoid alcohol, smoking, processed food. Eh? I did not say you should be eating anyhow food. Hmm? Yeah. Okay. So before I continue, you can join my private community. You can join my private community. I have a private Telegram. I have a private Telegram channel. Hmm? You can only join through subscription. I'm coming. I just remember right now. I haven't spoken about it. Yes. Okay. So, um, I have a private community. I have a private community on Telegram. I have a private Telegram channel. And for you to join, you can only join when you subscribe. So if you want to join my private Telegram, there's a link on my page. Hmm? There's a link on my page. Look for the link, subscribe, and join. You can't join by looking for my community on Telegram. You can't. You can only join when you subscribe. Good evening. Good evening. What does ECG and chest X-ray dictate? It checks your chest, checks your heart, checks your lungs. I should come to Austria. When I have money, I will come. Cynthia. When I have money, I will come. Don't worry. Good evening, doctor. Well done. I have been following you for a year plus now from Port Harcourt. Oh, thank you. I'm watching from Bonu. Anna, how is Bonu State? Um, I hear una conversation. No, which one? What does XYZ ECG? I've answered you. Who gave you this test? Akim. Huh? I'm from Nasarawa State, living in Port Harcourt. Abednego, how are you? I hear your conversation. No, miracle of politician. For where? Oh, okay, okay. I wish you guys all the best. Go and make proud. Thank you. Oh my God, I have to go. Do you have a longer version of your videos on YouTube? I'm asking because those on TikTok are very short. Yes, all my videos, all my videos are on YouTube. All my long versions are on YouTube. All of them. I cannot post the long versions of my video on TikTok. They are on YouTube and Facebook. All my long videos are on YouTube and Facebook. I post the clips on TikTok. Good evening, doctor. I'm watching from Jos. I have a chronic ulcer and it's affecting me in the head and spine. Please help me. Who be this? Maverick. Who told you you have ulcer? And what do you mean by it's affecting you in your head and spine? Because ulcer does not affect the head, Mr. Maverick. So who told you that what you have is ulcer? I'm about leaving. Honestly, I think I'm tired. Doctor, what if someone is sleeping too much? Even after sleeping 7 to 8 hours at night, I will still need to sleep in the afternoon. If not, I will not feel better. Could it be a symptom of sickness? I think maybe your body still needs more sleep. It might just be a sign of sleep deprivation. It's actually your body telling you that it needs more sleep, rest. And then, if this has been happening to you for a long time, I think you should see your doctor. But the first thing I think you should do is give your body a break. If you are working, you haven't gone on break for a long time, try to go on a break. It might just be your body giving you a sign that it needs more rest. We were told that you need to take booster after 10 years of the three doses. After 10 years, I'm not sure. I'm not sure. I will confirm. But please, if they say you should get your booster dose wherever you are, follow the advice. But I'm not sure. No vex. Sometimes the vaccine is for life. So I don't know why they said like that. In some cases we give booster dose. True, we give booster dose, and sometimes the vaccine can also protect you for life. Oh my God! Watching you from the Federal University of Maiduguri. Yes. Who be this? Yusuf. Yeah. Avoid Pepe. Yeah. Good evening, Doctor. I'm Sharif from Sharif. I see you. Good evening. You said victim of hepatitis can eat anything food, but some doctors said they should not eat meat. I'm confused. Who be this? Amos. Which doctor said that? I'm waiting for you. I want you to give me your comments. Which doctor said if you are hepatitis B positive, you should not eat meat? Oh yeah. Oh. Amos, tell me, which doctor said so? Amos, I want to end the live session very soon. Amos, which doctor told you that if you have hepatitis B, you should not eat meats? Oh yeah, now I'm waiting for you. I'm looking for your comments. I'm waiting for you. Is the person here? Which doctor said if you have hepatitis B, do not eat meat? Tell me, tell me. I have shared though. Shezi, thank you for sharing. Oh God, oh my God. The funny thing is that the people, I think it's time to go. Where is Amos? Amos, what's your name? Amos what? Amos John. Oh yeah, tell me, tell me. Oh yeah, tell me. You no give me the Gary and granite again. No vex. You don't finish. Eh? Nora, you don't finish. No vex. Eh? Where is Amos now? Wait, tell me say then tell and say because he get hepatitis, make you no chop meat. Who said so? I saw my period on 17th. When is my ovulation? Go and watch my video. Hmm? Go and watch my video on how to calculate your ovulation. Ijeoma. Huh? Go and watch my video on how to calculate your ovulation. You can't just come online and say that you saw your period on the 17th. Then how how can we tell you your ovulation? Madam, that's not how it works. Hmm? Madam, that's not how it works. You need to tell us a lot. You need to know the length of your menstrual cycle. Hmm? Do you understand? So let me see. Uh, oh my God. Good evening, sir. My eyes always itch me. What kind of test should I do? See your doctor. Let them check your eyes. Or maybe you are allergic. You don't need to do any test. Every time people will just come online be asking for tests, madam. Eh? There are some things you are doing that's making your eye itch you. Maybe it's your environment. You're having allergies. Eh? Maybe it's dust, cold, that's causing your eyes to itch you. It's not something you should be every time you're looking for test. What should test? So what you should do is avoid those things that makes your eye itch you. Hmm? You know them. They can make your eyes itchy. They will make you sneeze. They can make your eyes red. So most times people suffer from allergic conjunctivitis, meaning allergic reaction. And they make their eyes they scratch them. So stop asking for tests online. Test is only recommended at the hospital. I have to go, ladies and gentlemen. Good evening, doctor. I had a brother who suffered for osteitis in one of his testes, and one of his testes was removed. One of his testes was removed. He's asking me that I am a med lab student. What is the probability of him giving birth? Cause still his other testes is paining him. So, what's your name? Yaji. A man can give birth to 100 kids if he chooses to with just one testis. Huh? With just one testis. A man can actually give birth to as many kids he wants with one testis. But if he's complaining that he's having testicular pain in the other testis, advise him to go to the hospital immediately. Hmm? Um, advise him here so that they can check him here. Afternoon, doc. I need consultation. How do I go about that? Consultation. Okay. Let me do this. Let me do something here. Um, for anybody who wants consultation, for consultation, send a mail. Send a mail to this email address. My admin would respond to you and tell you all you need. Let me see. Okay, for consultation, let me do this. Let me post it here. Okay, for consultation, send a mail to Doctorfredostar@gmail.com. My admin would respond and tell you everything you need to do. Yes. Oh my God, questions are so much. I need consultation. How do I go about it? Is it by joining Telegram? Oh no, Telegram is not for consultation. No, it's just for easy response to questions. Telegram is a community. There are people there. So when you are in Telegram, if you drop questions, I respond to you immediately. When I go live on Telegram, you can speak with me. There are people there. It's not one-on-one consultation. Yes. So that is different. But if it's for a one-on-one consultation, you can send a mail. I think I have to go. I think I'm now tired. What causes hot flashes in the head? It comes like headache, but it's not steady. It's not steady. Hot flashes in the head. What is hot flashes? What do you mean by hot flashes in the head? It comes by head. What do you mean by hot flashes in the head? Because when you say hot flashes, please use a plain term. Don't use term that might be confusing for everybody to understand. Because when you say hot flashes, I know what hot flashes mean, but I don't know if that is what you're talking about. So break it down. I have to go. I think I'm tired. You people did not send star. Nobody send super chat. Nobody send super sticker. I'm begging you to share. Good evening. Trust you are good. And by the grace of God. Well done. Well done. I think I have to go. Um, Let me see. Uh, Please, doctor, my sickness is only catarrh and sneezing. How do I stop it? Catarrh and sneezing is your sickness. There are some things that are causing it now. You know, Mr. Felix. Huh? Your environment might be causing your catarrh and sneezing. There are people like that. Any little thing they can sneeze. They sneeze to dust, they sneeze to cold, they sneeze to perfumes, they sneeze to smoke, they sneeze to AC. Huh? Yeah, so it might just be. So what you can do is also you can try to also support your immune system. I made a video on how to support your immune system. So you can watch the video, rest, fruit, water, and then supplements can also help. Glory to God. Edward. Okay. Doctor, when normally do you do the live program? I mean the days and also the time. So during the week, I don't have a fixed time because I work 9 to 5. I'm not a full-time content creator. So I can't tell you that I'm going to be live on Monday or Tuesday. But every Sunday by 8 p.m., every Sunday, you will definitely meet me online on YouTube and Facebook every Sunday. That has been on for about 5 years. But during the week, I can't tell you, I can't give you any time. But if you follow me very well, I would always give you the updates before I go live during the week. Yep. I think I don't tire. I really, really don't tire right now. I think I have to go. I have to go. Answer me. Who be this? Jane Frances says, answer me. Jane Frances, I can't see your comment. My friend also tell me that her doctor tell her not to eat meat because of the hepatitis B virus. If your friend is having so listen carefully. If your friend is having hepatitis B and your friend is having a problem with her liver because of hepatitis B and her doctor advised her that does not mean they are talking to you. Every time my friend, is it you, Abi, is your friend? That does not mean because you have hepatitis B, you cannot eat meat at all. But if you are having liver affectation, your liver don't they collect, your liver don't they get small, small problems, they can advise you to leave certain foods for some period of time. But that does not mean everybody with hepatitis B positive will now leave meat. Sometimes we tell them to eat fish because fish contains omega-3 fatty acids and the rest. Fish is very healthy. But that does not mean you can't even eat meat at all. I don't tire. Okay. I used to try and join his Telegram channel. You'll be able to ask questions and he's ready to answer. A lot of people don't want to subscribe and join Telegram. A lot, a lot. When you tell them to subscribe, they go they vex. But I think I have to go. I swear I don't tire. No vex. Can hepatitis B cause pain in the throat, tongue, mouth, lips? Not really. Who be this? Emmanuel. Not really. No, no, no. Pain in your throat, your tongue, your mouth, your lips. Now something else they cause them. If you're having pain in your tongue, your throat, your mouth, hepatitis B is not known to cause those kind of symptoms. Eh? Emmanuel, you hear me so? My questions. I can't see your questions. I don't see. Some of you are just coming. Some of you are just coming and you're asking me questions. I've been here since and I have to go. I don't try. Hmm? No vex. Yes, yes, yes. So once again, let me drop this here. So this live session was question and answer session. Ask me anything, and I've been here for more than an hour. It's not easy though. It's not easy talking for 1 hour, cracking your brain. It's not as if I'm here cracking jokes, laughing, talking about Nyash and the rest. I'm cracking my brain. So it's hard, you understand? So when I say I'm tired, just know that I'm tired. Hmm? If you want to join my private telegram, you can join through subscription. There's a link on my page. You can subscribe and join my private telegram if you want to join. And then for anybody who wants to book for consultation, you can use the mail. You can send a mail. My admin would respond to you, will tell you the process, will tell you the amount and everything you need to know. Apologies. I don't do private chats and I don't give out my number. Thank you for your time. Thank you. If I did not respond to your comment, I'm sorry. I'm a human being like you. No vex. But I think I don't try. I have to go. I'll see you some other time. Tomorrow is Sunday, so I'm going to be live tomorrow by 8 p.m. Remember, remember. Shout out to Mommy Monisade. Shout out to you and to everybody watching me. Take care of yourself and have a wonderful evening. Remember, good life. Good life.